I think there's really a couple responses to that. The first is that the urologist and I are geographically close. We're in the same building. Many patients come and see both of us in the same day. They'll see the urologist to hear about prostate cancer surgery. They'll come see me to hear about prostate cancer radiation. So being close together is important. There are times when patients have emergencies, rarely, but there have been times when patients have emergencies and they can go from my office to the urologist's office in 60 seconds. I don't have to get on the phone and call somebody and see if they're there that day. I think that's important. I think also in the big picture, most practices in the United States, and what I've participated in really before I came here, was surgeons and radiation doctors, for lack of a better term, competed over patients. The surgeon tried to talk the patient into surgery, the radiation doctor tried to talk him into radiation. The situation here is different in that we're all in the same group, and our goal is really, we want the patient, number one, to be cured of their cancer, but number two, we want them to feel like they heard every option before they made a decision, that they weren't convinced to choose one course of action because that's what they heard first, or because the more persuasive physician talked to them. I tell my patients, I want you to hear another opinion. If you haven't heard about surgery yet and it's appropriate for you, I'm going to send you to the surgeon. We're not just going to jump right into radiation. There's patients who actually want to see a physician outside of this practice, in which case we make that referral. So our goal is, we want the patient to be cured of their cancer, but we also want them to feel like they were empowered to make an educated decision about their treatment.